All right, gang. Here's what you've all been waiting for. Actually today I'm not going to speak probably much at all. John's gonna be the star of the show in XIMA. So if you guys don't remember John, this is Jon Florence. He is the vice president of sales at XIMA. So he's got some exciting things to talk about regarding XIMA specifically in the healthcare vertical. And I think he's going to show us some cool new things that XIMA's got coming down the pipe. John, I'll hand it over to you and let you do your thing. I'll manage questions in the chat. So if anybody has any questions for John as we go, I know he doesn't care if I interrupt him. So we'll get your questions all answered, or we'll wait till the end, depending on what they are. So
Sounds
thanks
good.
for thanks for joining us today, John. I really appreciate it.
Yeah, appreciate it, Jamie, and welcome everyone. I'm excited to share some new enhancements to the contact center, which again is now available to you through RingLogix. But we're also going to focus a little bit more in the healthcare space. Contact center in the healthcare space, it is very relevant. And a lot of companies need a contact center solution. I'm going to show you why. And you can take that information. I'll make sure Jamie has a copy of the presentation that she can share with you after today's webinar. So you can talk to your customers about it, whether new prospects or existing customers. So we'll talk about the healthcare space and really understanding what the problem is. How is a contact center solution going to help the problems that healthcare is facing? We'll then go over again some of the new features, some of those designed to help that healthcare space specifically, but then can apply to a lot of different organizations as well. And then I always like showing a little bit of a live demo. I don't like just having a paper trail and saying, look at what it can do. I want you to see it. And that really resonates, I feel, with a lot of partners. Okay, as mentioned, if you have questions, feel free, go ahead and ask those. We can address them during the webinar or after. I do this a lot. Like these to be as engaging as possible. Okay, so with that, healthcare. Well, what kind of businesses are we talking? A lot of times when you think contact center and you think healthcare, you think instantly, oh, well, you're probably talking about the big hospitals. They do exist, and those are they have contact centers, but it's typically not where our contact center plays. It plays more in the smaller healthcare space. Locations like instant healthcare, smaller clinics or providers. They can be a single site, they can be a multi-site. In fact, earlier today, I was on with a dental office that had like 8 phones, but they needed a contact center solution. I'll kind of explain why. Insurance companies that deal specifically with healthcare, medical manufacturing, pharmacies, or specialty offices. A lot of times in those hospital environments, they have kind of smaller subset of offices, outpatient surgery type offices. Those are a great fit for the contact center solution. Okay, so those are the type of offices that typically we see, and healthcare is the biggest vertical our contact center solution is in, followed by financial vertical. Okay, so what is the problem? What problems are we going to have, and why does this matter to healthcare companies? First, bad impressions as well as last impressions, typically associated with wait times. Almost all healthcare providers care about wait times. I mean, sometimes you're driving down the highway, you can even see some of the ERs advertising, here's our current wait. They pay money to advertise on the freeway to show their current wait. That's how important it is to them. And it isn't just in person, it's also on the phone or just getting service, getting the help that they need, because people are very passionate naturally around their health. So again, that patient experience, and we'll talk in a little bit more slides here, why that patient experience is so important, and why healthcare companies are so particular about wait times. That's the first impression that anyone's going to have. The next problem that they're having issues with is staffing. Now that could be nationwide, but it's especially bad for the healthcare space. And I'll share some numbers around that. And then, just overall patients difficulty getting care, and all of these things, those are kind of the subset or the minor problems. Top of the problem list is profitability. Just like any business, healthcare providers, they want to be profitable as well. So how do they accomplish that? By just throwing bodies at it, which they're struggling to find. And so it can really cause this ripple effect in how the business operates. So some numbers around that. These are from Forbes. And when you get the presentation, it has the article linked in down under the notes if you want to take a look at it. So this is from a Forbes article in 2023, later part of 2023. So it's been a few months, but it hasn't changed. In 2023, they polled.
Hey, Jon, I don't want to interrupt you, but I think on my screen, I'm still seeing a Jen. Were you chatting away?
I had it paused. Thank you. As soon as you said that, I looked back. Just so, again, I talked about it. You have the slides here. So let's look at the numbers. Thank you. Thank you.
You're welcome.
So some of the numbers that were reported per Forbes. 76% of patients that they surveyed didn't report a positive experience. It wasn't necessarily bad, but it wasn't positive. They didn't have a great experience. So you could say 24% of patients are like, oh yeah, that was a great experience dealing with my healthcare provider. Of the people they polled, 60% outright said they had a negative experience. Now, why does that matter? 33% of the people polled said because of that bad experience, they are looking for a new provider, a new person to take their healthcare needs to. Again, at the top is profitability. And what's unique about healthcare, for the most part, you're not under a contract with your doctor. You don't like your doctor, you can look up your in-network and go find a new doctor tomorrow if you want. And again, what usually leads to that is that bad experience. Okay, I'll share a personal story here. My father had some health problems earlier this year. Went to the doctor. They then sent him to a specialist, and they said, oh, you need to go talk to this specialist. He called that office, waited in line for 30, 40 minutes is what he said, then hung up. And he was expecting him to call him back. He was frustrated. I called him. My sister called him, and we're like, hey, did you get that appointment? He's like, no, I can't get a hold of him. And so what we do, they're like, well, what kind of specialist is it? And he told us. And so my sister and I went to Google, found like 4 other doctors, started making calls. Another doctor was able to get him in the next day. So again, that instantly moved because of that bad experience, not getting through. He went and saw a different doctor in the same specialty area. Okay. So again, very important because again, typically that all goes back to that profitability. From a staffing perspective, there's been a 50% increase in resignations for core jobs within the healthcare space since 2020. A lot of workers are leaving that space and they're not going from, if you're a nurse, you're not going to be a nurse from one clinic to another nurse in another clinic. They're leaving the industry in general. And what projections show is there is actually going to be a 3.2 million staffing shortage by the year 2026. So that, again, causes this huge problem. You care about patient experience, but you can't just keep going and hiring staff and throwing at that because that's going to hurt the profitability and you don't have the people to find. So it causes a lot of problems. So how do you improve that patient experience without causing problems? Okay. And this is just some more statistics about that first and bad first and last impressions. 5% of all calls to healthcare providers are too long and the customer hangs up. 5% sounds like a small number, but when you start thinking what that could be, it could really become a big number in patients for the different customers. There's also, when you start looking at contact center solutions, there's this problem that can happen where the contact center, not really the same system as the office. And if you're that smaller office, that can cause a big problem because a lot of people wear multiple hats. So if I take the call in the contact center and I can't just immediately transfer you over to your doctor without a 10-digit number, that's a problem. And that happens sometimes when you get into those big enterprise-grade contact center solutions. The routing, again, because they're two disparate systems, can cause problems. They're also in multiple platforms. Sometimes they have an internal chat tool, could be Microsoft Teams. They have their EHR or EMR, their electronic health record system, kind of like the CRM for healthcare. Then they have the phone system. So there's a lot of applications that these people are using, which can slow down that experience, can cause problems in that experience for the patients. Okay, again, this just talks to the data tracking and accuracy by, okay, I'm reporting things out of my EHR, I've got my phone system. What process am I supposed to follow? Well, there's different tools that XIMA can provide to address each of these. Let's talk about the cloud and the CC. We have a very tight integration with the RingLogix platform, which makes it feel like a single system. In fact, the same employees can use the same phone they're using today, but then they get a number of the different features functionality that they may be looking for, such as EHR and EMR integration. We have released integrations that can do data consolidation and bring patient information over to the agent's phone so they can see exactly who they're talking to without having to go look it up. Big thing that people always verify when you call into healthcare: can I have your date of birth? Can I have other details just to confirm I'm talking to who I think I am? If you don't have that integration, you get that call, you have to go open up that account in EHR, you have to verify that. We can just pull that information into our agent client. And so then they can be like, okay, I've got it right here at my fingertips. How can I help you? We also have a very good scripting tool that is specific to a customer that is very process oriented, but again, can be very beneficial in the healthcare space. So again, cost of losing a patient. What does that mean? And we'll use the experience I shared. Other couldn't get a hold, went to a different provider. Again, 33% of patients said they would switch providers following a negative experience. Okay, so that's problem number one. Another statistic from that Forbes article, 52% of patients said they would tell others about their negative experience. So you're going to lose that potential word of mouth marketing that every business thrives off of. So solutions, how can you help with this? One, meet the customer where they're at. One, queue callback. I asked my dad, because business I'm in, I'm like, well, when you called, did it give an option to call you back? Because you hung up. Or why would they call you back if you didn't do a queue callback? He's like, I didn't hear anything about that. Queue callback has been shown to reduce abandoned calls on average by 38%. Now, XIMA, we've done some things with our queue callback to increase that number. And I can speak to that a little bit later. The next, multi-channel. Give patients another way to reach you besides calling. And that's one of the new and exciting enhancements that I want to share with you today. Customers in the IVR can elect, hey, you know what? It's not an emergency, but I need to get this scheduled. Send me a text from the IVR so I don't have to call in. Or maybe I call into the queue and we can say, hey, press 1 for a queue callback. Or if you'd like to turn this conversation into a text, press 2, press 0. It can be any of the buttons. And so we can turn that call instantly into a text conversation with an agent. It's not those appointment reminders. Typically, those come from the EHR in EMR system. That's just kind of an automated system that happens over there. We're talking about what happens if you need to reschedule it, you need to cancel it, and you want to actually chat with someone about it, not just go through the automation of that EHR. That's where the multi-channel can really help in those environments. In fact, this is from our research. We hired a third-party independent company to interview our customers as well as customers on all other contact center solutions. You can see in the healthcare space, they communicate about 50% with their patients on phone calls. So they're definitely emailing, they're texting, they're web chatting, they're doing these other communications that you could have with your customers. And these aren't your traditional, again, contact centers with 50 agents. They're 5 agents, they're 4 agents. They're small little environments sometimes, but can have a significant impact. Because if you have a person that's, at the front desk, checks people in, they can handle 10 text conversations at the same time with people just looking for information. Okay, and I'll show that here today. These are some of the other features that have been added over the last few months with our multi-channel, just improving that multi-channel experience. We've had SMS for a while now. It is that MMS. Okay, so if someone's like, oh, hey, my child got hurt, can I speak with the doctor? Well, maybe the doctor has a screen where they can log in. Send me a picture of what they got going on. Okay, yeah, you need to come in. Okay, or for whatever reason, or maybe someone needs to pay an invoice and you want to send them a copy of that invoice via text. Here it is. You can send that attachment file. Better email metrics so you know what your agents are doing via email. And what I see used constantly in the email space is almost every single provider out there has that contact us on their website. Just ask them, where does that go? Almost every time it comes in as an email. Where does it come in? Oh, it comes in an Outlook shared box. Who's responsible for responding to that? How quickly do they respond to it? Usually, people just log in when they can, and I don't have any visibility into when someone gets response to. That's what this is going to provide. It's not necessarily going to change that experience for the customer, but it's going to allow you management to be able to determine, okay, how quickly are we getting back to our patients if they email us? They fill out that contact us page. Once agents know they're being measured on that, the response time goes up dramatically. Okay. I talked about the opting out and the IVR SMS option. We've also provided and added a new IVR. This is for those customers that need to do a little bit more, just a little bit more than what comes out of the box with NetSapiens. Okay, what I mean by that is database dips. That's probably the biggest one. Oh, I want to dip into my EHR. And based off the information I get, they're routed over to a specific department. Maybe if they have an outstanding invoice, don't send them front desk, send them straight to billing so they can pay that. Again, different tools with that. I'll show what that looks like today. Then we've also released an updated web chat. So a lot of great enhancements around this multi-channel. And I'll say why a lot of partners bring us in on the NetSapiens platform, because it can do some queuing. It can do some SMS from a group perspective, but it's not the best experience. What if I get a text and I need to, leave? Okay, well, you can transfer that text. There's also settings for if no response. If the customer doesn't respond within a certain time period, go ahead and end the conversation. If they text back in a day later, okay, start a new one. Or if an agent, again, this matters in the healthcare space. Some people are doing those texts and they're the front desk people checking people in. Well, what if they're having an active text conversation, but someone walks in, big emergency? Well, you want to take care of that person that's there versus the text. It doesn't mean you want to just forget about the person on the text. So if I'm busy now with someone that walked into the office, that message can re-queue, be sent to a different agent that maybe has a little bit more availability. Okay, so agents don't have to always remember to transfer this in case they get busy. Okay, so a lot of great settings in there when it comes to the multi-channel. This is just what it looks like sending that SMS out of the IVR. You can select what number you send that on behalf of, what announcement you want to tell them, and then what message is being sent. Okay, so that can address a lot of that first impressions, that patient experience when they call in or communicate with the office. Okay, in person is its own different process, but remotely, that's its own process as well. Let's talk about the shortage problem. What do we do with staffing and shortage crisis? Okay, just some numbers here. Again, back in 2020, around 400,000 people would resign from their position in the healthcare space. That number increased to 600,000 in 2023. So more and more people are leaving that healthcare job. So there's constant turnover within the organization. Okay, so that's specifically in healthcare. You can see down here in the nurses side, a huge number as well. And it's very common. I've seen a lot of environments where nurses use a contact center solution. And they're not dealing with patients in person, they're dealing with them remotely. So these tools can help with that. Whoops, I clicked on a link. There it goes to the article. Yes. So again, you can click on these links when you get to the article. That's fine. So some solutions to help them. Well, one, it's about AI. The biggest two, workforce optimization and then speech analytics. Those are probably the big two that I see in the healthcare space. If you got that bigger customer with 40, 50 plus agents, and they're spread across different time zones, multiple offices, workforce management can have a factor. But I've seen a big boost in customers that are in the healthcare space wanting workforce optimization or speech analytics. And here's why. Here's why this matters. From a workforce optimization perspective, the simple question to ask your customers if there's a need for this. Okay, so you ask the question today, are you recording your calls? They'll either say yes or no. It's a simple question. Take it one step further. Ask them, what do you do with those recordings? Why are you recording calls? It's almost the same one of two answers. Scenario number one is, oh, I go listen to a call if I get a complaint or a disagreement about something, I need to go review that call. So it's kind of there when I need it. That's scenario number one. Scenario number two is, sorry, getting a call here. I go and listen to my team's calls about 3 times a week, 4 calls a week, 5 times. They're using it to just make sure and kind of a quality management, a little spot check. Okay, how do you go pick those calls? I kind of pick them at random. What do you do with them? Oh, I take down notes and then I review it with the agent. That workforce optimization is designed for that environment. And the reason why you want to promote this to your customers is because this will put you in the driver's seat if it's a competitive deal, such as you're going up against a Zoom or a dial pad or a Ring Central. Okay, I'll give you a scenario of a customer. Again, 8-agent environment, not massive, 8 agents. The UC had something like 50 phones, but an 8-agent environment. We were in there with a RingLogix and Sapiens partner, and then they were also looking at Ring Central. And I got on, did the demo. Originally, the demo was just voice contact center. Kind of skills-based routing, but it was more around reporting and analytics. That was the big need the customer wanted. But then I asked the question, okay, are you recording your calls? And she said, yeah. Like, what do you do with it? And they said, oh, yeah, we listen to about 3 calls a week, and then I score them in an Excel spreadsheet. And when the team hits a certain goal, they get a prize. She's like, recently, I just bought them a popcorn machine. The next thing they wanted was an ice machine. Okay, so there was this motivational factor. And so I showed the manager the workforce optimization, absolutely loved it. After the demo, I called up the partner and our sales rep that was helping as well and said, hey, congratulations, you probably just won the deal. And they're like, why? I'm like, because what's going to happen now is they're going to go back to Ring Central and they're going to say, hey, we saw this awesome workforce optimization tool. And I know what Ring Central uses. It's Calabria. It's very expensive, but it's not much different from a feature functionality perspective. So you just put yourself in the driver's seat because you're way more affordable. Again, we designed our contact center, which then extends to you, to fit that small, medium-sized business. And so if the feature parity is on par, that's going to help you win the business. So these advanced applications can help you beat the competitors. So if you're up against a dial pad, even if the customer's not saying they need speech analytics, you're going to want to show them speech analytics because I can promise you 100% dial pad will lead with that throughout their entire demo. They will try to sell the value of it. And so you can just let your customer know, oh yeah, we have it. Here's what ours looks like here, but you can add it on when it makes sense. And the benefit for the speech analytics is that second scenario I talked about on the call recording. Okay, so you listen to a recording if there's a problem. Yes. How do you know there's a problem? Oh, usually it boils up if the customer reaches out. But what about the ones that had a bad experience that don't take it all the way to let management know? They don't know about it. They don't know if there was a bad experience unless the patient or customer takes it far enough to make sure management knew they were upset. Speech analytics can make sure you know 100% of your customers' bad experiences, which again, we saw what kind of impact that can have on the business. So that's why you want to just talk to them about it. We've had a lot of customers where they don't do that day one. but they want to pick a solution they know they can grow into. Okay? All right, moving quite along here. And this is what I just talked about, crawl, walk, run. A lot of these customers, if they're not in those advanced contact centers today, do it in phases. And you can do that. That's the nice thing with the XIMA solution and how we priced it. You can add on those advanced apps when it makes sense for the business. The other options, they try to push it day one. Okay. And so crawl, walk, run with the solution. And the XIMA professional services team there is to help ensure all of that goes smoothly. Okay. The last thing I want to talk about that we've added, this isn't specific to healthcare, but just good for you to know, Teams. We've made some pretty significant enhancements as it relates to Microsoft Teams. Now, this does work in the direct routing environment. This does work in the Operator Connect environment. But where you're probably going to do that is in the RingLogix environment. And I'll show you why this matters and why customers love this so much. Okay. Here's again the value proposition, but rather than me just talk about it, let me show you what I mean here. Okay. And in fact, I'm going to show in the web view first. Okay. Again, I have all those different metrics here. I've got an SMS. I've actually got 2 SMSs and an email waiting in queue. So you can be alerted. I put these in prior to the demo, but I have a counterpart that's about to do a demo as well here in 5 minutes. And he might take these if I log in. So I see that those messages are waiting there. So I can go ahead and make myself available. Here they come. I've got my SMS that I get. You know, someone wants the status of the claim. I got a web chat that's coming in as well. And then I also got an email. Again, that contact us page. It all comes in that single pane of glass. And this actually leads to why the Teams integration matters so much and why you'll want to talk to your customers. I was talking with a partner yesterday, and he's like, oh, well, yeah, we get people that ask us about Teams, but they're small. They're not the typical Teams customer. Doesn't mean they're not asking you. And the reason why they ask about it, when you drill down into your customers, you're like, why do you want Teams? Teams is, and hopefully there's not any huge Teams fans here. Teams is a phone system. It's not great. It's very basic. But the reason they're asking for it is if they're a Microsoft shop, their employees are in the tool for their internal chat messages or video calls. And so they have it open on their PC. So now, okay, if you're in an environment that has an agent, you've got Teams here, maybe you have the agent client, and then maybe you have, your soft phone as well. It's about consolidating the applications. That's what they care about. And that's where the advantage of XIMA and Teams matters so much. Let me explain. One, they don't need that Teams phone license. So that $8, $15 license to enable this phone, we don't use that. You do not need that with our Teams integration. But what it can do, okay, your employees use Teams. Okay, they're going to be agents that handle chats and SMS. Okay, let's have them log in right here. And more importantly, it does single sign-on with Teams, which is fantastic. So that, just log me in, okay, based off of my credentials here. Here's the other unique thing that we did. Bidirectional or presence sharing, meaning agents, of course, they have their contact center state here. I can make myself available, and I can make myself available here and be like, oh, you know what? I'm going on a meeting. But they also have their team state. That's going to let the contact center manager know I'm not available. But what about the rest of the office? Well, you'll notice that automatically updated my team status as well. And it goes both ways. So, all right, what if I'm an agent? I'm not living on the XIMA client. And I come over here and I want to change my status here from available to, you know what, I'm going to be right back. Well, we push that state down to the contact center. There you can see it disabled my voice channel. So if they're busy inside of Teams, they're not going to get a contact center call. But then here's the unique thing that, again, if your customers is interested in Teams and they have a contact center, this will be a winning solution for them. I promise. They'll absolutely love it if they know Teams. Let me call in. Okay. That's ringing Nick, so I can see that's ringing my counterpart. That's fine. He's not going to answer it because he knows I'm doing a demo as well, and it's not him calling in. So that's then going to ring over to me. Again, it's using that skills-based routing. Here it comes. I'll go ahead and answer my call. You'll notice again, that's living directly inside of Teams. I didn't answer it on that phone icon. I answered it in the XIMA app. Almost every other solution in the market will pop out another application. So if you ever seen Genesis or Dialpad or Five Nines or Ring Central, they pop out another application, like the Ring Central softphone. Why do they do that? The reason they do that is really all this app is it's an iframe. It's a website living inside of another application. And the problem with iframes is, well, if I'm on an active call like I'm doing here, and I click off that page, it shuts down the audio connection. It shuts down, it basically disables the page. So that's why they pop out the application, so their calls stay active. But XIMA, we found a way around that. That call is still active. It's still talking here. You might be able to hear my echo. I don't know. Sometimes these webinar tools are pretty good and they block the audio. But my call remains active over here. I don't have to stay on the XIMA icon. I don't need the Teams phone license to use everything inside of Teams. And that call's been counting up this entire time. It's been recording this entire time, the conversation, regardless if I'm on the phone or not. So again, very powerful tool. But let's go back over here, because again, not everyone needs Teams. If I want to respond to this email, oh yeah, can't remember those details. Let me look it up in the HR, and your appointment is today in 10 minutes. Okay, I can send them over a message. Probably not going to show up if that's actually their reminder. But the SMS, that's again a big use case on that. Better queuing options as it relates to this. So, what's the status of my claim? This is kind of out of healthcare. Let's go auto, be like, oh, I need a picture of the accident. So I can send that over, and that's going to come over to me as an agent. But again, if the customer doesn't respond to that after I send a response after 30 minutes, I can end the conversation. Or if the customer responds, sends over a picture or a text, I accessed my camera. I want photos. Boop. That'll come across. And I can also load the history of those different communications. So, is this a customer that chats in often? There it is. And again, it's not just the thumbnail. So if I need to see that and be like, oh, yeah, I remember this one. Your car is totaled. There is no claim. But if I wanted to send that attachment, I can. Or again, if I need to transfer this. So it just gives better group queuing options as it relates to SMS. But one that I'm very particular about that I think is going to have an impact for a lot of businesses. That opting out of queue or from the auto attendant, the ability to send a text message. So let me show you what I mean here. So, and hopefully you can hear this. If not, that's okay. I'll show it. Okay, so here's our auto attendant, general auto attendant, but I'm going to press 0 to receive that text message. I can see, oh yeah, I went to the appointments opt out. So it's going to send that SMS here as soon as the message is done. It's just confirming that we're going to send a text message to this. And that might be it. That might be it. That I could send that text message. Some use cases I've had is they're like just directions to the office or a link to just schedule the appointment. So I could put in the IVR. If you're looking to schedule an appointment, press 0 now and we'll send you a text so you can schedule that appointment. Again, it's all about call deflection because that takes the most time. What I always tell customers, the second you send someone a text, they may not need to reply to that today, but they'll now assume that's an open channel. A month from now, they might be like, oh, I got this text from them then. I'm going to just text them back. You don't want that to be, a black hole that doesn't go anywhere. So they can text back, or maybe they can't do what they need to from the message that you sent. Okay, so I just sent a reply back. that can go to a different queue. So now I know, oh, someone did reply to our SMS we sent out of the IVR. And it didn't route to me because I'm in do not disturb. So I'll make myself available. Here it comes. And what did they send? Oh, yeah, they're not. I sent them a link to schedule their appointment. They're not looking to do that. They're looking to cancel the appointment. Okay, well, I have their phone number, and that's where the EHR integration could come in. For example, I'll call into that same auto attendant. This time I'll just go to sales. We can pull up information. There I know, oh, Jon Florence is calling in and his client or patient ID is 687471. I believe the one I have this connected to today is eClinicalWorks. Okay, so there's the call connected. And now I have a whole bunch of information over here on the right-hand side. You'd be like, okay, account manager of this is, Jane Doe. Obviously, I have this in a demo environment. And count number, age, email address, there's different fields we can pull from the EHR. One that I really like to show is, do they have any outstanding invoice amount? A lot of customers really like to know that. Or again, they need to verify who they're talking to. I've got the social security number in there. I can show their birth date. Could you confirm your birth date for me? What's the last four of your social? 6789. Okay, perfect. Hey, Jon, how can I help you today? I didn't have to go open my EHR to do that process adherence. Okay, and what that's using, I'll just go ahead and end some of these communications here. We'll end that SMS. That's fine. Is it's using our IVR here. So again, you could still use the RingLogix IVR, but then if it's going to come to the contact center, you can have it do just a quick database dip if you wanted to do that. There I have my customer lookup, and it's just putting that into my different IVR call flow. Oh, that's my SMS option where again, it confirms the number, sends it, drops the call. Here's how it got there. And so it's got these different steps. And again, it's to provide enhanced routing that just sometimes, it's not all the time, but sometimes you can't do that with what comes out of the box. And then with XIMA, of course, you want to verify those details, the patient information. Okay, you have all of those interactions via cradle to grave, as well as the phone call. So, okay, what information did it pull? How did it do that? Oh, yeah, it's doing a database dip, customer lookup. What information did it pull in? Right there. So it'll show that in cradle to grave. And if they want to run reports on that as well, they can do that. And then their recordings are over here on the right-hand side. So I simply press play. Again, I put it on mute there so you don't see it. But typically you see when there's talking or silence. You can speed it up, you can take notes, you can download it, you can email it, and you can create a snippet. Okay, that's the base recording. There's then again those enhanced applications like speech analytics and workforce management. I'll just show real quickly the advantage of the speech analytics. Again, going back to, well, without it, you're dependent on the customer expressing their concerns over an experience. So if I really wanted to know, let me look at the last month here. I don't want to. If I really want to know my patient experience, it says client, but that's okay. I can now see that. And I can see, all right, collectively, my patient experience is about 75% is positive. But about 25% of my calls, the customer's having a bad experience. And if I want to drill down to that, I can. I can click on, oh, show me my negative calls. There, it just filtered all my negative calls. Is it the same agent? I'm seeing Robert here. Whoa, Robert's showing up a few times. What's going on with Robert's calls? Maybe it's specific to an agent. Well, I'm going to get my transcript of that so I can see text. I can also see where it was negative, where it's positive. I might get in trouble for this, but that's okay. This is historical real-time transcription. It is on our roadmap to add real-time transcriptions and speech analytics and embed that in the agent client. I don't have a firm date of when that is. I would say probably Q1 or Q2 of 2025, but it is in our roadmap to bring that more into the real time. So if customers do want that, they can do it. We realize it's a direction they're going. We want to make it a very useful speech analytics tool, not or a real helpful AI. A lot of times it's a flood of information, and you hear customers, they say constantly, oh, I shut it off. And it's because it was more of a distraction than it was helping. Okay, so we have that historical now. So again, I can see where it was negative and positive. It is doing based off keywords and phrases as well as tonality. So you can kind of hear if that was in their tone or what they were saying. And you can click and play from here. You can also have the system auto score the calls. So if you want to know, how many people called in and talked about an appointment, how many appointments did we get? Of course, your agents can tag that, but if you want to have the system, in essence, summarize or give you a summary of what that is, you can have the system auto score that. So I can see this agent, got a 50% on their compliance, got a 75% on their communication skills. These are different. It's looking for specific phrases that are particular to their business. Again, not everyone's going to verify social security number. You might verify birth date or patient number or something else. So you can custom build what these are looking for. If a customer's looking more for that manual quality management, I want to have touch because AI is good, but it's not perfect. There's still that, I'll call it human element that's missing from that, where, okay, well, that I can kind of see why the agent did what they did. This is going to be very black and white. Did they say it or did they not say it? Sometimes there's that leeway. And so the workforce optimization gives the agents the ability to do that as well, or the supervisors. The other benefit for this is the ability to also turn on screen capture, which I do see a lot in the healthcare space. And here's why. Here's why in the healthcare space. Again, missed appointment or a wrong appointment time. Well, of course, if you have the recording there, the customer's like, I thought my appointment was at 3. You listen to the recording and it's like, oh yeah, the appointment was at 3, but gosh, in our system, it says it's 2. How did it get to 2? Well, by having that screen, maybe I can see, oh, okay, here's where they're confirming that appointment. Obviously, this isn't a healthcare. But, oh, that's why the agent said 3, but they selected 2 o'clock. That's where the error happened. So it's beneficial to be able to see what they're doing as well as hear what they're doing. And then you can fill out your own evaluation. Like, did Jon talk about quality management? Yes. How was the webinar today? Oh, it was an 8. Why? I could put in free-form notes down here, or something was good or unacceptable. And again, that's where you can drive that agent performance. It might seem a little silly that a tool like this can actually help with agent retention. So again, this tool is designed to help employees stay longer. And you might be like, why? How does a tool like this help healthcare retain their employees? Two ways. Scenario number 1. I like to refer to the phrase quiet quitting. Now in healthcare, they might actually just be going the whole way and they quit. The number one reason why employees quietly quit is they don't feel appreciated at their job. Number one reason why people will just quietly give up. Stop giving as much as they did because they felt like it wasn't appreciated when they did, so they're going to do the bare minimum. This can overcome that because if I'm a supervisor and this happens, a lot of times what do supervisors do? They spend their time on the agents that need help. If an agent's doing a good job, they sometimes forget to tell them good job because they're doing a great job. So this can eliminate that. Oh, if I listen to a call and Jamie did an awesome job, well, this system can acknowledge that. And it can give Jamie points, which can then be redeemed for rewards. It can show up in the dashboard. So like as an agent, I can open up my company dashboard and I can see, how do I measure up? And you'll be able to see what your supervisor scored your call. So they know you did a good job. And they're acknowledging you for that. Maybe not in a personal voice, but in a score. Okay, that goes a long way. But here's the other benefit. Most employees complain the reason they weren't successful at their job is training. They feel like they were never adequately trained. Oh, I got onboarded in a week and now I was supposed to be perfect at it. No one remembers everything what they heard the first time. And so that's why I like the second part of workforce optimization. And I've asked this, it's a trick question. A trick question. I ask this on every demo. So if you bring me in on a demo, I'm going to ask it if I'm showing this tool. I'll ask the supervisor and manager, if you listen to an agent's call and they did something wrong, like, oh, Jon, that's a 3, and oh, that, you didn't do that, and oh, that was unacceptable. If you listen to a call and you don't go correct that agent's behavior or coach them up, what are the odds they'll do the same thing next time they're presented that same type of call? Without fail, every single time they're like, oh, they're going to do it again. Because again, you're not hoping your employees are doing things maliciously. They're just doing the best that they can. And so it's a resource thing. It's a time thing. If supervisors can only listen to 5% of calls on average, they can only also allocate a certain amount of time for training. And so sometimes, okay, let's just give the agent a reminder. Okay, it's not that they didn't do this the way we want. Let's give them the resources so next time they'll do it the way they want. And it's all automated. It'll send that agent the appropriate coaching module. Okay, now of course that's set up in the setup in the mapping. So if Jon scores poorly on this type of call, send him this training. So they'll get an email that says, hey, you've been assigned a training to watch this video. This also comes across as less threatening. Just think about in your experience. Have you ever been yelled at a boss? Probably wasn't very fun. But if you got an email that's like, hey, you didn't score very well on this call, please go watch this training. It's still not the best, but it's not going to really upset you too much. Just gives you a little bit more to do, but it's not going to have potentially that same experience if a supervisor comes down on you pretty hard. And sometimes people have that emotional side. This takes emotion out of it. It sends it over as an email, and then management can monitor and make sure that the agents are watching the training that they have. So those are all kind of the different key details that really can help an employee stay at that business. They're getting the training that they need. They're getting in a way that's not threatening. They're being acknowledged for the job that they're doing and, being rewarded for it. That all goes into agent retention. Okay. That I know is a flood of information over the last, 50 minutes or so. So next steps, what can you do? Again, get with your CAM at RingLogix. They'll connect you with our CAM. Let's get your team personalized training. You want more personalized training specific to a vertical? I'm doing a webinar here next quarter in finance. Maybe I can convince Jamie to have me on in Q1 and Q2 to do the same thing for this team. A lot of exciting things that are coming.
You got it.
If you deal with finance, credit unions, banks, smaller ones, the big thing in that industry, little teaser of what's coming, voice biometrics. All about security. So the system will be able to give back to the agents confirmation. Yeah, this is who they're talking about. If you haven't run into that, again, it's coming up a lot because security is the big thing in the banking or credit union space, which is also propelling us into that real-time speech. So a lot of good things coming. Schedule those trainings, schedule a demo for your customers. I love doing demos. My favorite part of my job. There's some days where I literally do 8 demos in a single day, back to back to back to back. There is not necessarily a better day than that for me. So get our team involved. We're always happy to help. And then we'll help the RingLogix team with the design so you can present that with your customer. And then we can give recommendations if you're competing against a competitor. I do it all the time. That's my job that I get to report to our board where we're winning, where we're losing against our competitors. So I can give you their strengths, their weaknesses, and our strengths and weaknesses so you can sell around them. Any questions for the group? Wanted to leave some time at the end for questions.
No? No, I thought everything is super cool, Jon. I'm really excited that everything looked awesome.
Thank you.
Yeah, and gang, too, like John said, if you don't know who your Zima cam is, that's fine. Reach out to our team. We'll get you set up with the cam. We'll do a warm intro for you. And Zima helps you every step of the way too. So they help you pre-sales, they help you post-sales, and they help you support your customer. So if you're looking at this thinking, wow, this is really, really cool, but I don't know how to manage it, like you don't have to. So that's awesome. Like, as far as partners of ours, Zima takes, complete ownership of their product and helping you guys, sell it, install it, and support it. So you don't really have any worries there. And John, you're more than welcome to do one on finance the first of the year. I would love that. So, or
Awesome.
whenever you want to.
Yes,
So
it'll be great. A lot of good things.
well, I don't have any questions. I must have some shy violets on here, or you just did that awesome, John, that they don't have any questions.
They're
So,
like, I answered everything.
right? They're just waiting. They're going through their Rolodexes looking for their customers, right? That they can send over to you for demos. So, well, cool. If you guys do have follow-up questions and you were too shy to ask it here, you can always reach out to me, and we'll get the question over to, or we'll get you connected with your cam, or we'll try to answer it the best we can. So. But thank you as always, sir. I appreciate it. I always learn something new when you get on a call with us. So,
Awesome. Appreciate it. Thanks, Jamie. Thanks,
uh,
everyone.
thanks everyone. Have a great day.
Bye.
Bye.